Morning everyone and welcome to the webinar. This is the MBBS and FD options in abroad. I'm Tanmoy and I'm the counseling head at MeetUniversity. So let's get started. So why should we go for MBBS or MD options in abroad? Well, we selected this topic because nowadays the competition for getting into the government aided medical seats is really competitive because as far as the statistics are concerned, it's around like 30,000 students in India. They compete for one government aided one government medical seat. So that's really very stiff competition. So it's at the end of the day, I think only 2% of the all the medical aspirants get into a government aided medical college or university. And there are options like private medical colleges. There is a lot of private medical colleges and universities in India, but the problem with those colleges is that the price, I mean the costing, they are getting getting beyond the reach of middle class Indians, because like the tuition fees is really high. Then on the top of that, there are capitation fee or donations and stuff like that. So the things are getting really difficult. So I guess it's really high time that you all the young Indian students who want to be a doctor, a medical doctor, which is a very noble profession, I think you should expand your horizon and look beyond India in order to be a medical doctor. It's not that in the medical education in India is not good, but since the demand is very high for being a medical doctor in India, but the infrastructure is very limited. I mean, very few number of government medical colleges, and as I said, the medical colleges in the private sector are really expensive. So I think it's better to look some other options because they are really good quality education and the price is also very cost effective. So let's start it with some of the options. So the first in the list would be Germany. Well, I guess most of the people know about Germany, that it's one of the biggest economy in Europe and it's a very developed country. They are really one of the powerhouse when it comes to science and technology, and it's not an exception in case of medical technology as well. In medical science, Germany is one of the front leaders. So, what are the things you need to do to study the first degree of medicine? So, I would like to clarify that MBBS, which is the first degree of medicine in India, in Germany it will be MD. So don't get confused that is in India what happens. You study the first degree of medicine, which is undergraduate of medicine. That's MBBS, and after that you do post graduation, which after that which you get a degree of MD or MS. But in Germany and some other countries, the first degree of medicine is MD, and after that you just do your specialization while practicing in the clinic or hospital. So in Germany, you need to, if you want to apply to some of the German universities, of course you need to study physics, chemistry, biology at plus 12 level or plus 2 level, or also known as HSC in some of the Indian boards. You also need to have 6.5 or 7 band in IELTS. So IELTS is the basically that's the test for testing your English proficiency. Apart from that, you do need to know a very good level of German language, which is either B2 or C1. So there are two cases you could do the MBBS or MD in Germany. First, you need to do like you can either learn the German language while being in India. So maybe you take a course from all the German language centers like A1, A2, B1, B2, and then C1. Then you apply to the universities in Germany, or another alternative would be like you go to Germany using the student visa, then you enroll into a language course, German language course, which would be typically say 1 year or 1.5 year. So you learn the German language in Germany, then then you get shifted to the medical school, and then you start learning your your medical lessons. So both are good options, and both have pros and cons. If you learn German in India, that would be cheaper. Of course, that would be cheaper, but the problem would be when you apply to the German medical universities and when you apply for the visa, the interview would be very tough. I mean, because if you are learning German in India, of course, you are speaking German or interacting in German only when you are learning or very limited time. You will be around friends and family. You will be speaking in your mother language, native language, and not necessarily in German. But when you learn the German language in Germany, the advantage is you will be in Germany, you will be surrounded by Germans, you will have the chance to speak German, you will have the chance to interact in German with other people. So the learning will be more effective, far more effective. But yeah, the disadvantage is it will be costly. It will be costly if you compare with learning German language in India. But it's worth it. It's definitely worth it, because the advantage of studying medicine in Germany is that the medical education is almost kind of free, because as you can see, the duration of MD in Germany, that's the first degree of medicine, that's 6 years. The intake is in September, October, and the cost, the tuition fees, as you can see, is 0 to 750 euros per year. So 750 euros, that means something like 16,000, or yeah, 16,000, even less than that. That's per year. So the tuition fees is really low because the education is subsidized by the German government. So if you are studying medicine as an international student in Germany, you don't need to pay any hefty fees. All you need to take care of is your living expenses, which would be, of course, that would be a bit expensive, but still, if you study the MBBS MD in Germany, I think the whole cost would be something in between 24 to 30 lakhs for the whole I mean maybe 7.5 years. Because as I said, if you learn the German language in Germany, so 1.5 years, then the 6 years of the medicine degree, that's so total 7.5 years. Even if you stay, or even if you spend all the 7.5 years in Germany, I think the costing will be still within 30 lakhs. And the advantage, I mean, you can recover that money, because when you are a student in Germany, you can work part time, then you can earn something around 400 to 500 euros per month, or maybe more than that. So you can basically cover your living expenses. Then in your 6th year, in your final year, you will be doing internship, you will be doing rotation, and you will be earning around 20 to 30,000 euros per year. So basically it will be 1 year internship, and you will be earning 20 to 30,000 euros, so which is basically 18 to 20 lakhs or 24 lakhs, depending on the currency value at that time. So you can recover all your money, I mean what you have invested during your MD course, you can recover all of that before finishing your medical degree. After finishing your medical degree, there's a huge shortage of medical doctors currently in Germany. And like people who have got their medical degree outside Germany, even they are eligible to practice in Germany if they pass the required exams and some other regulatory stuff. So if you study medicine as an international student in Germany, you will have a very good opportunity to study practice there and to do medical practice. And the starting salary for medical doctors in Germany is 49,000 euros. So that's like around 37 38 lakhs per year, in Indian rupees. So that's a this very handsome earning. And some of the top ranking universities, there are a lot of medical universities in Germany. I think there are around sorry about that, there are around, I think, 100 university, or I think 60 to 70 very good and reputed medical universities in Germany. I have listed some of the top ones. Say for example, the Charité is in Berlin, then University of Bonn, University of Cologne, University of Hamburg, University of Hanover, University of Heidelberg, Leipzig, then Ludwig Maximilian University in Munich, then Munster, Tübingen, University of Ulm, and University of Würzburg. These are all very good medical schools, very good medical universities in Germany. Now that's it all about Germany. Now let's move on to our next option, which I would say the Caribbean. Now, what's the specialty about Caribbean? Okay, I am not sure if you know what about Caribbean. I think many people have heard about the Caribbean mainly through cricket, because the West Indies plays cricket, and they are one of the countries in Caribbean. But the Caribbean is basically the Caribbean islands, which are situated between North America and South America. So you can say that's the Central America. So there are some of the countries which are basically islands, like Antigua, Barbados, Netherlands, Antilles, Jamaica, Grenada, Cayman Island, and West Indies also there. So they are used to be like the colonies of the other countries. For example, Netherlands Antilles, that's still a part of Netherlands. There are some other islands which are part of UK. Then there are some other countries which are part of say US. So they used to be colonies, but now they are independent countries, but they are still associated with their parent nations. There are around 60 medical schools in the region, which are top class universities and schools, and they provide both MBBS and MD. The curriculum is very much USMLE oriented. So if you know about USMLE, that's the basically the entrance exam, which makes you eligible to practice in the US. So if the curriculum is very much oriented to that, and if you're studying in the Caribbean, you basically get training. You are basically trained from the first day to like you have to crack the US exam, and you will be eligible to practice in the US. Every year, around 6,000 students from the Caribbean get absorbed in the US hospitals every year. So that's a very high number, very high number. The duration, the duration is 5.5 years if you are a class 12 pass out student, and it's also possible to do the medicine degree if you are from BSc background, and that will be a fast track. It will be 4 years. So suppose you didn't get a MBBS option or something after finishing 12, you basically did BSc, say in zoology or some other, maybe BSc in biology or BSc in zoology or BSc in botany, or maybe BSc in biomedical science. After that, if you are still willing to, like, no, I want to be a medical doctor, you can still enroll for the course, and you will duration will be 4 years. Eligibility will be 55 to 60% in your class 12. So that's the minimum eligibility, and for good universities, for good schools, you need to score higher than that, maybe 70 or 75%, and they really focus on the marks you have got in physics, chemistry, and biology combination. Maths, that's also a good one, you need to score high as well, but the focus will be mainly on physics, chemistry, and biology. And you also need to crack IELTS for few universities. Costing, it varies. I mean, there are a lot of universities where you can do something, let's say 6 to 10 lakhs per year, and there are some expensive one as well, like 10 to 15 or maybe 20 lakhs per year. But scholarships are available. So if you have got good scores, and if you, because sometimes you need to do an interview for the scholarship application, so it will be, you can have that, you can reduce your expenditure. And how the model works, so basically what you do, I'm just assuming that most of the students are class 12 or class 12 pass out students. So you study class 12, you finish to class 12 plus 2 or HSC, and the physics, chemistry, biology, that's the mandatory combination. After that, you apply to the Caribbean universities. So basically, first 1.5 year you study the pre-med program. That's the, like, first 1.5 year. It will be, they will prepare you. Even you have got a bit, because some students might have not got that much strong foundation in some of the fundamentals. So they will prepare you just to bring you and fine tuning, to get you a fine tuning. So first 1.5 year it will be pre-med program. Then the next 2 years will be basic science program. After that, you have to sit for the USMLE step 1. So after that exam, once you finish that exam, you are eligible to move into US, UK, or Canada, or maybe some other European countries for the clinical rotation. So that's up to you. But I mean, you have the option to even do the rotation in the Caribbean islands, but most of the students, they do their rotation in some other country, because most of the students mainly go to US, Canada, or UK. So after USMLE step 1, you do your clinical rotation. After you finish the 2 years, you have to appear for the USMLE step 2 and step 3. And so that's for if you want to go into the US, if you want to practice in US. But if you want to come back to India, then of course you have to sit for the MCI screening exam, and which is right, which is the mandatory thing if you want to have a medical license in India. After that, you get the MD degree, which is, as I mentioned, it is equivalent to the MBBS in India. After that, is up to you. Like, as again, like, you can go to US for your residency or postgraduate program, or you can also go to Canada. And if you wish, you can also come back to India. So it's up to you. But yeah, as far as my experience is concerned, I have seen most of the students going to US or Canada after studying their MBBS in the Caribbean. The next country on our list is Poland. I guess most of the people know about Poland as well, because like the Marie Curie, the two times Nobel Prize winner, she was Polish. And then again, a lot of other stuff for Poland as well, because in the recent years, Poland has been emerging as one of the top destinations for study abroad, not only medical science, but also from other branches of education, let's say engineering, computer science, and biomedical science, chemistry. It's really good in Poland. So Poland has always been a very strong in science. What used to happen earlier, that they didn't have courses in English, but now they are offering courses in English, and it's really good. The Polish medical science is really good. Eligibility criteria, well, you need to score, yeah, 60 to 75% in class 12, and IELTS is mandatory for any university. It's not that it's optional. If you want to study medicine in Poland, you have to sit for IELTS, and you need to score at least 6. And for good unis, you need to score maybe 6.5, because it's competitive exam, because it's not only you are applying to the university, there will be other candidates as well. So if you score high, so you don't need to score very high like 6, 7 or 7.5 out of 9. If you score 6.5, it will be good enough. And if you have good marks, 70, 75%, 80%, then you'll have very good chance to get into Polish university, because Polish medical science is very good, and a lot of people from India and from all over Europe, they go to study to Poland. So it is really competitive. But if you have got a bit less marks, maybe less than 60%, maybe 50 or 55%, because sometimes it happens that you study really hard for your HSC, for your plus 2 or class 12, but it just didn't go well. So it's not the end of the world. You have to study 1 year extra, so it's called the pre-med program. So basically that's 9 to 12 months, and after that you can join the actual medicine program. So there are chances, there are options. So there's the beauty about the education in like in abroad countries, because if you have good marks, if you're really good, you can get into the program directly. But even if you have a bit less marks, you have to study 1 year extra. So basically you get into the groove, you get into fine tuning with other students, and then you can join the actual program directly. So duration 6 years, so that's the actual duration. And if you do the pre-med program, it will be 7 years, or 6 years 9 months. But generally the actual program is 6 years. Intake, it starts August or September, October. So there is no intake in, say, January or February. The main intake is in the during the autumn, which is August, September, or October, also known as fall intake. Costing, well, it's 12 to 16 lakhs per year. Living expenses is not that high in Poland. It's 20,000 to 40,000 per month. There are other options, like you can do part-time work, and you can also practice in the UK or other European countries after doing your MD from Poland. Some of the good universities in Poland, the Medical University of Warsaw, that's one of the best in Europe. Medical University of Lodz, Wrocław, these are all very good universities. So after Poland, let's move on to Hungary. It's another European country, and it's also really good in medical science. Like, it's very good quality of education and cost effective. Eligibility criteria: 60 to 80% class 12. IELTS is mandatory as well. Pre-med program, as like in Poland, is available as well. Duration 6 years. Intake is in January, February. Poland, it was September, October, or August, but in Hungary the intake is January, February. Tuition fees a bit less than Poland, 6 to 12 lakhs per year. Living expenses a little bit higher than Poland, but if you look at the overall thing, it is really cost effective. 6 to 12 lakhs per year and 35 to 50,000 per month as living expenses. So living expenses include your accommodation, your hostel, your food, your transport, clothes, books, everything. So it's everything included. And some of the good universities, the University of Budapest and University of Debrecen, this one is there's a really good universities in Hungary. Now let's move on to Ukraine. Ukraine, okay, just let me clarify that last year the Ukraine was in the news for some political reasons. But let me assure you, in some parts it was mainly in the Crimea that there was some political tension. Well, if you are really scared, okay, no, there's something wrong going on, some political tension. Well, don't be too much afraid about that, because in the media, well, you do hear a lot of news about this on the media, but it's not always the case, because at least now in the present, as far as we know that the things are getting back into normal. It's like, say for example, in India, say some problems are going on in Kashmir along the border for ages, but that's happening in Kashmir, in the border area, which is up north. But if you are staying in Delhi or Mumbai or Kolkata, there are not that many problems. So it's the same thing. Something is going on in some of the border area. So with the Crimea, there's between the border between Ukraine and Russia, so some problems are going on there. But if you are studying in some other cities in the mainland or near the capital, near Kiev or other city, it's not that much a problem. So if you just avoid, I mean, you just need to check with the embassy and everything. So basically, Crimea State Medical University, that's in Crimea. So if you just avoid that, I think there's not that much of a problem, because Ukraine is a very good medical education, and it's really cost effective. The eligibility criteria is a bit it's like 50 to 60% like other universities, well a little less because you can even get into a medical program with 55%, but still I mean the education is really good. IELTS 6, but it's not mandatory for all universities. The duration, well, the duration is 6 years, and the intake is September, October, and you have got another intake in February, March. Costing, well, the fees will be 2.5 to 4 lakhs per year, and the living expenses is quite cheap. It's really cheap. It's 10,000 to 15,000 per month, and it seems like Caribbean. You get preparation, you get trained for the USMLE PLAB and MCI exams, which are organized during the weekend. So basically, on Monday to Friday, or maybe you study for your medicine actual courses, and on the weekends you basically get preparation from the university without any extra costs. You get trained for the USMLE PLAB and MCI exams. Some of the good universities in Ukraine: Ivano-Frankivsk National University, Kharkiv, Odessa, Lugansk, Staropol, Crimea, Kiev, Bukovan, Sumy, Voronezh. These are all very good universities. You can check their websites, and you just need to decide okay which one you want to apply for. Now let's come back to a bit to the Asian region. So in Asia, there are some other options as well. Like I think in the last 3 or 4 years, or maybe yeah, I think the last 4 or 5 years, few people are, many people are going to China for MBBS education. So it's cost effective and a lot of options are available. I think it is one of the good destinations in Asia. The eligibility criteria is 60 to 80% in class 12, and the duration is 5.5 years. It's the same like India. The intake, there's a one intake in August, September, then there's another intake February, March. Tuition fees, it varies, but you will get something within 2 to 6 lakhs per year. I think there's some expensive ones as well, like 7, 8, or maybe 10 lakhs per year. But on an average, most of the universities is like 3 to 6 lakhs per year. Living expenses is quite cheaper to some other countries, 10,000, 20,000. Only one drawback in China is that after you finish your MBBS in China, you have to come back to India because China has got a really big population. Everyone knows it's more than 120,000 crores. So it's a it's really big country. So it's not always possible, of course. I mean, if you are going there, you have to come back, so that's a bad thing. But you can do your quality MBBS education in China, but you have to come back to India. But in other countries, like, you have the options to stay back. Some of the good universities in China, like China Medical University, Dalian Medical University, Fudan, Jiangsu, Zhejiang, South American University, Sichuan University, and there are a lot of big. I think there are around 70 or 80 universities which are really world-class universities, and you can check the websites on Google, or just maybe you can send us an email if you need more information about medical universities in China. Now, one of the last one on our list is Georgia. It's another good country in Europe. It's a very peaceful country. It's really nice. A little bit colder, but I think it's if you want to save money, and get good education, I think you can manage that. So the eligibility criteria is 50 to 60% in class 12. You need IELTS, but not for all universities. The duration, same again, 6 years. There are intakes, two intakes, from September, October, and then again in February, March. The tuition fees is 2.5 to 4.5 lakhs per year in Indian rupees. Living expenses is 10 to 15,000. It could go maybe higher, but not more higher than 20,000. So basically 10 to 20,000 rupees per month. Some of the good ones, like I mentioned only two, but there are some other ones. AIETI Medical School and then Geomet University. These are some of the good ones in Georgia. Just I would like to mention that when you are selecting a university in Georgia, you need to check that is the MBBS course which are MCI recognized. If you want to go there for MD, the MD program is not MCI recognized. So just be careful with that. It's a MBBS, that's MCI recognized, okay? But the MD program, that's not MCI recognized, because that's very important, because all the countries, all the universities I mentioned here, they are all MCI recognized. So when you're going to, for example, it's not I'm against some of the countries, but for example, a lot of people have been going to Russia for a long time for cheap medical education. But apart from St. Petersburg in Russia, no other university is MCI recognized. Even they are not recognized by the EU regulations. So be careful with that. There are some other countries as well in Europe, like Latvia or Lithuania or maybe Estonia. You can also consider studying MBBS in those countries, because mainly three advantages. One is, of course, you get good quality of education. It's cost effective. You don't need to spend 70, 80, or 1 crore for your MBBS. You basically spend, say, 30 to 40 lakhs for your MBBS. So that's really cost effective. And then again, you have the option to stay back in those countries or to move in some other countries in the Europe. You can move into UK, you can move into US as well. So you just need to clear the exams. For UK, you need to clear PLAB, PLAB, and for US, you need to crack USMLE. And if you want to come back to India, of course, you need to crack the MCI screening exam. But as I said, these are all very good alternatives for, because you just need to know the value of your money. Because if you are studying MBBS in India, then you need to spend in a government medical college. Then what you need to know that you might need to spend 30 to 50,000 for 5.5 years. But when you are going to in a private sector, private medical college, you have to spend 70 to 80 lakhs or maybe more than that, because the tuition fees is quite high, maybe 30, 40, or 50 lakhs. Then you, on the top of that, you need to pay the donation of the capitation fee. So that's really like, it is getting beyond the middle class families. So I think it's a high time to, if you look beyond these options, because as I say, in Germany you have to spend 30 lakhs or maybe 20 lakhs in 6 years. It's not that you have to pay 30 lakhs out of your own pocket at once. So just consider these options, because if you just be a little brave enough, because some people they think going Germany is far away from home, but that's a good thing, because once you go abroad you'll learn a lot of other things. Because I'm not sure if you have watched my other webinars, you can have the advantage of studying abroad in on those webinars. But as I said, I mean, it's the main three advantages: quality education, cost effective, and more career opportunities, because you get the option of practicing medicine in India but also in other countries, UK, US, and Canada as well. So that's the best thing. So yeah, that's it, and I will repeat it now for now. And if you have got questions, then I'm happy to take it now. Any questions? Okay, yeah, that's a very good one. So I would like to answer like this. So I just for other listeners, other and other attendees. So one of the guys is from sorry, what's yeah, it's Rakesh from Mumbai. Okay, so his question is like he wants to know that is it worth enough, that what's the risk if you study MBBS in Germany and if you come back for the MCI exam? Well, it depends, because it's, even if you study medicine in India, it's not that you will be a good doctor. So it depends on your talent. If you get admission in India, but if you don't study hard, if you don't put effort into your education, in your studies, there's no point. You won't be a good doctor. You won't get into a good clinic or good hospital, or maybe you might not get into a good PG program. But so in that respect, it's the same thing in Germany. So the German education is really good. And don't worry about this IMSA exam, because if you do your studies properly, there is no risk that you won't clear the IMSA exam. I know a lot of people have this doubt, but you have to be confident enough, because it's like uh, for example, if you study like hard in your first year, then second year, but you didn't study in your third year, so of course you won't get into the fourth year. The same thing. So it depends on you how you take the opportunity, because you have to study hard, and it's not a like very big deal that you won't get an opportunity in India. Yeah, most of the people they stay back in Germany because it good exposure, good salary, good earnings. But if you want to come back to India after practicing for 3 4 years, it's not a problem, because the German universities, the German education is MCI recognized, the MCI approved. What you need to do, just you need to crack the MCI exam. But as I said, if you study properly for your MD, and other courses, then it's not a problem to crack the MCI exam. Any other questions? All right then. So I guess that's everything for this session now, and I'll take a leave now. Just for other viewers, if anyone is interested, there will be another because this was on medicine, MBBS, and MD options in abroad. There's another webinar which is career in biomedical sciences. If you are interested, if you want to study undergraduate or masters in biomedical sciences, because it's also closely related to the medicine. Well, that webinar is at 1:30. So if you're interested, you are really welcome to attend that as well. So for now, yeah, I will just take a leave and thank you for listening and good luck.